how to fill out your application. On your dashboard, click the Start New Application button to get started. Next, you'll need to verify your identity. For help, watch our How to Verify Your Identity video, then return here once you're confirmed. Before moving forward, check the box to agree to BeWell's privacy policy, then click Save and Continue. Take a moment to gather all your information. For anyone applying for coverage, be sure to have names, addresses, social security numbers, dates of birth, and immigration document numbers on hand, if applicable. The application has 5 sections. Each section should take on average about 10 minutes to complete, depending on your household's details. You can move between completed sections of your application by using the Steps panel on the left. Click Continue to move forward. Begin with entering basic contact information. If you'd like to receive important alerts at your email address, check the box below it. If your mailing address is the same as your home address, you can check the box to copy it over. Next, confirm your phone number. Click the Edit button if you need to update it. Then, review your contact preferences. A few things to note. After completing each page of your application, click Save and Continue to save your progress and move on to the next section. If you need to pause and take a break, click the Save and Exit button. When you log back in, you can start from where you left off. Before you enter information about your household, let us know if someone is helping with your application. This could be a certified assister, friend, or family member. If a friend or family member is helping you, you can name them as an authorized representative. This gives them permission to sign your application and act on your behalf for all matters related to your application and account. If you choose Yes, you will need to provide their basic information and give consent to sign your application on your behalf. To find out if you qualify for help paying for your coverage, choose Yes or No. Now, let's move on to the About Your Household section. Here, you will enter basic information for everyone in your household. Be sure to choose Yes for anyone in your household who is seeking coverage. To add someone, click the Add Person button. Enter their name and date of birth and choose Yes if they are seeking coverage. Repeat for all household members. Now, establish the relationship between everyone. Use the drop-down menus to select how everyone is related. For your husband or wife, select Spouse. Check the box next to anyone who doesn't live at the primary address. If you have a child who splits their time between 2 parents who do not live together, enter the address where they spend most of their time. Before moving forward to the Family and Household section, take a moment to review your household summary. If you need to make any changes, click the Edit button. When you are ready to move to the next section, click Continue. The Family and Household section asks for more details about everyone in your household, such as social security numbers and citizenship status. Click the Continue button to move forward. Start by entering your own information first. Confirm your sex assigned at birth by choosing male or female. Then, enter your social security number. If you don't have one, check the box. Choose Yes to confirm the name you provided is the same on your social security card. Next, report your citizenship or immigration status. Choose Yes or No to report if you are a U.S. citizen or if you are a naturalized or derived citizen. The ethnicity and race section of the application is optional. If you choose to answer them, BeWell will use this information to better understand the demographics and health needs of New Mexicans. Next, choose Yes or No to indicate whether you are a parent or caretaker of any children on your application. You will repeat this section for everyone you added on your application. Before continuing, take a moment to review your household information and confirm everything is correct. If you do not need to make any changes, choose No. Now, you will provide information about federal income taxes. Check the box next to anyone who plans to file a federal income tax return. If you added a spouse, choose Yes or No to indicate whether you plan to file a joint federal income tax return. Please note that you must file jointly with your spouse in order to receive advanced premium tax credits to lower your monthly premium, unless you can meet certain criteria as a victim of domestic abuse or spousal abandonment. Next, check the name of the tax filer who should be the primary applicant for this application. Then, check the name of the dependent who will be claimed on the tax filer's return. If anyone in your household is Native American, check their name and indicate if they belong to a federally recognized tribe. If this doesn't apply, check none of the above. Now, let's move on to Medicaid. Check the box next to anyone who has Medicaid that recently ended or will be ending soon. For anyone this applies to, you'll need to enter the last day of their coverage. You'll also be asked if their household income or size has changed since being notified their coverage was ending. If this doesn't apply to anyone, check none of the above. Check the box next to anyone who was found ineligible for Medicaid in the past 90 days. If this applies, enter the date coverage was denied. If you don't know the exact date, provide your best estimate. If this doesn't apply to anyone, check none of the above. If anyone in your household was pregnant in the past 12 months, check their name. If this doesn't apply to anyone, check none of the above. If anyone has a physical disability or a behavioral or mental health condition that limits their ability to work, attend school, or manage daily tasks, check their name. If this doesn't apply to anyone, check none of the above. Please take a moment to review the information you provided for everyone in your household and confirm it's correct. If you find an error, use the Edit button in that section to make the change. When you are ready, click Continue. Now, let's move on to the income section. Before we get started, gather income information for everyone in your household, like W-2 forms and pay stubs. Start by telling us about your income. If you earn income, choose Yes. Next, click the Add Income Source button. Now you'll provide details about each income source. Depending on the type of income you select from the drop-down, like a job, self-employment, or other income, the form will look a little different. Enter the information requested for each source, such as the employer's name, the amount you earn, how often you receive it, and whether you expect this income to continue for the whole year. Then, click Save to add your income source. Use the Add Income Source button to add more than one source. Next, you'll be asked about deductions. These are items from a tax return, like alimony, student loan interest, or other deductions that may lower the cost of your health insurance. Choose Yes or No. If yes, select Add Deduction Source to provide the details. Enter the information requested for each deduction, including the amount and how often you receive it, and whether you expect this income to continue for the whole year. Click Save to add your deduction source. Based on the information you provided, we will estimate your projected income for the year. Choose Yes if this is accurate. If you choose No, enter in your projected income. If you are not sure, select I don't know. Please take a moment to review your income summary. If you need to make changes, click the Edit button. You will repeat these steps to report income for everyone else in your household. Click Continue to move forward. Before moving forward to the final section, take a moment to review the income information for all members of your household. Click Continue to move forward. In the final section of your application, you'll be asked for additional information. Choose Yes or No to report if you are enrolled in health coverage that will last beyond the next 60 days. If you chose Yes, check the box next to the type of coverage you have. In this optional section, report if you reconciled your advanced premium tax credits, or APTC if you received them in the past. Answer Yes if you filed and reconciled, No if you didn't, or choose I have not received APTC if it doesn't apply. Choose Yes or No if you will be offered health coverage through your job, including a spouse's or another household member's job. Choose Yes or No to report if you have been offered a health reimbursement arrangement, HRA, through your job or through a family member like a spouse or parent. If you select Yes, fill out all required fields of the form to provide more details about the HRA. You will repeat these steps for everyone else in your household. Click Save and continue to move forward. Finally, in the Additional Information section, choose Yes or No to report if you would like help paying for medical bills from the last 3 months. Next, if you are eligible for Medicaid, check the box next to your preferred managed care organization. Before you move on to the Review and Sign section, double-check all the information you provided for all members of your household. Click Continue to move forward. You are almost done. Next, you will finalize your application and provide your e-signature. Take a moment to do a final review. Use the Download and Print buttons at the top to save a copy of the summary. Use the Edit buttons if you need to make any changes. Click Continue to sign and submit your application. Before you provide your e-signature, read and check the box next to each statement if you agree. At the bottom of the page, you will type in your first and last name to provide your e-signature. When you are ready to submit, click the Submit Application button. After your application is processed, your eligibility results will appear. From there, your final step is to choose a plan and make your first payment, called your binder payment. You must make the binder payment in order for your coverage to take effect. For guidance, watch our how-to video. Complete your enrollment and make your first payment. Let us do the work for you. Free help is available at BeWellNM.com.